Good morning and welcome to Southern Maine Healthcare's Medically Speaking. I'm your host, Robert Erickson, and for the next 30 minutes, you'll hear about medical issues and topics of the day directly from leading medical professionals at Southern Maine Healthcare. My guest today is Dr. Christopher Hughes from SMHC Neurology. We'll be discussing the diagnosis and treatment of sleep disorders, certainly a popular topic in today's stressful world. Welcome, Dr. Hughes.
Thank you very much.
Dr. Hughes, we'd like to start out our show by finding out a little bit about you and how you got involved in medicine, specifically sleep medicine, and where you're from originally.
Well, I'm originally from Chicago. I went to undergraduate at Stanford University in California, which was the birthplace of sleep medicine back in 1978. A professor of neurology named William Dement was doing research on narcolepsy in dogs, and that was really the first research into sleep process and sleep disorders. After that, I went back to Chicago, my home, and went to medical school there. I obtained an MD and a PhD, and eventually ended up in a group practice in Iowa for 15 years, where I practiced general neurology as well as sleep medicine, and helped in 2 sleep labs that we had there. And after many years there, my wife and I decided to move to Maine, given the beauty here and the wonderful surroundings. So I was glad to join Southern Maine Medical Center about 5 years ago, and have worked here for that amount of time.
You mentioned that Stanford is the birthplace of sleep medicine, and it wasn't until 1978, you just mentioned. Why did it take so long for the medical world to start studying sleep disorders?
Well, I don't think there's a good answer to that. We do know that there was a lot of research into sleep deprivation in the 1950s. There were old radio shows done with radio announcers who would try to stay awake as long as they could for benefits. And what we found from that was that there's some real serious consequences of being deprived of sleep for an extensive period of time, to the point where the federal government actually outlawed sleep deprivation studies because of that. And I think it may have been as a result of that experience that people took sleep a little bit more seriously. Of course, with advances in technology and the work ethic of Americans, we started working a bit more, and we started to deprive ourselves of sleep. You know, there are more things to do, more interesting things to spend your time as we got through the 60s and 70s. And it's today a big problem that people don't get enough sleep.
And when you talk about sleep, what is actually happening, and why is sleep important?
Well, we do spend about a third of our lives asleep, and we know from those 1950s studies that sleep is very important, and if we don't get enough sleep, bad things can happen. It increases risk of a number of diseases and puts a strain on the body when you don't get sleep. I make the point to particularly older patients that sleep is not just the absence of consciousness, it's an active process. And though we are all pretty effective at obtaining sleep when we're young, as we get older, that process of falling into sleep becomes more difficult and can be disrupted much more easily. After about the age of 50, a little too much caffeine, a little bit of pain in your ankle, a little worry about family issues can easily keep you up in the middle of the night, whereas in your 20s and 30s, the sleep process is effective enough that often you can sleep through those kinds of things.
Now, I think everybody runs into friends and family who say, I only need 4 hours of sleep and I'm perfectly fine, while other people say, I need 8 hours of sleep. Is there a standard that should everybody try to get 8 hours of sleep?
Well, in general, most adults need somewhere between 7 and 8 hours for effective sleep. We do know that if patients deprive themselves of sleep for 4 or 5 days, they can, in a sense, catch up on a weekend. It's not completely effective, but the brain is able to compensate a little bit. But it's pretty rare for someone to effectively function as a normal person on less than, say, 7 or 6 hours of sleep. And that's a big problem these days with shift work, with changing schedules, with the demands that occur on people through their daily lives. Often people don't get what they need, and then they try to compensate with caffeine and other kinds of things. So I try to make the point to people that it is important to get enough sleep because of the consequences of not getting sleep. We know that, in particular, teenagers need a little bit more sleep than normal adults, and we know that teenagers have a lot of things on their mind, a lot of things they like to do. And because society requires them to get up and go to school in the morning, and they may cheat a little bit on their bedtime, the combination of needing more sleep because of the active growth that occurs at that age, plus the tendency not to get as much sleep as they should, really does produce a lot of drowsy teenagers.
Maybe as simply as you can, explain to us what happens to the body during sleep.
Well, we're not exactly sure what the actual needs of the body are, and we're not sure what builds up in the body when you don't get sleep, but we know that it is restorative. There are three general phases of sleep. There's light sleep, there's deep sleep, and there's dream sleep. And we know that during dream sleep, the brain does organize memories from the day, and we know that there are vivid images that can occur that we can all experience if we're awakened from dream sleep. There is a process by which we are, in a sense, paralyzed during dream sleep so that we don't run out of the room from the dinosaur that we're dreaming about or something like that. And if you ever watch a dog sleep, you know that their paralysis system isn't as effective as ours. They can yelp, they can move their paws as they are dreaming. There's actually a disorder in humans called REM behavioral disorder, which is a process by which that little paralyzing process stops working. And particularly in older people, this can occur. And unfortunately, during their dreams, they can yell and swing and actually get out of bed. So through these processes and further research, we are learning more about sleep. Another example is the condition fibromyalgia. We don't really know what that is, but we know clinically how it presents. A lot of people will have aches and pains, usually in the shoulders and the hip area, with no clear identified blood test or other pathology. The only study I've seen that can reproduce the symptoms of fibromyalgia in normal people was a study where they put normal 25-year-old people into a sleep lab, and every time they went into deep sleep, they woke them up so that they never got good sleep. And after 3 or 4 days, they had classic symptoms of fibromyalgia. They then allowed them to go back into regular sleep, and their symptoms went away. Now, most of us who've been up all night for one night or two from our own experiences know that the next day, everything does kind of hurt a little bit. So I'm not saying that a primary sleep disorder is the cause of fibromyalgia, but I suspect that when people develop a pain syndrome, it does disrupt sleep, and anybody who's in any type of pain will find their pain worse when they're not sleeping well. So there are connections there that we still haven't completely understood, but are very interesting for investigators and researchers.
So how does a neurologist fit into this?
Well, Dr. Dement at Stanford was a neurologist, and sleep is a process of the brain. The brain needs sleep in order to function properly, and we're now finding that with chronic sleep deprivation, there are other parts of the body that don't work as well too. But the brain is the part of the body that requires sleep, it activates sleep, it is the sleep system. So as I point out to my neurology colleagues, every primary neurology disorder is worse in people if they get lack of sleep. Alzheimer's, Parkinson's disease, epilepsy, migraine headaches, they're all worse if your brain is stressed by lack of sleep.
So what sort of treatments do you provide, and what sort of patients are you seeing?
Well, the most common sleep disorder is something called sleep apnea, and I see a lot of patients with that condition. It is a condition that develops for two basic reasons. It's a disorder of breathing during sleep. When we fall asleep, the back of the throat narrows with the muscles relaxing, and that narrows the airway. If you continue breathing through a narrowed airway, there's vibration, and that's where snoring comes from. But very frequently in people who have that, they will actually occlude that airway, and they will not be breathing many times a night. The brain senses that no air is moving and will bring you to a lighter stage of sleep, or will actually awaken you in order to get you to breathe normally. That can happen hundreds of times a night, and it disrupts the normal sleep process. So many patients with sleep apnea will spend 8, 9, 10 hours in bed every night and still wake up feeling very tired, and it's because they're not getting good restorative sleep. People develop sleep apnea usually for a combination of two reasons. One is the genetic facial structure you get from mom and dad, which does predispose certain people to sleep apnea. For example, a lot of people with sleep apnea have a rounder face. The other factor is weight gain, and unfortunately obesity is becoming a big problem in our society. So the more weight people gain, the more likely they are to develop something like sleep apnea. So when I see somebody with sleep apnea or suspected sleep apnea, they often have a family history of mom or dad snoring real bad, or maybe a brother or sister has a diagnosis of sleep apnea, and they often have a personal history of recent weight gain. And then they develop the tiredness and problems, and fortunately, family doctors and others recognize this as a potential risk, and they get evaluated.
Is some of this age specific? What sort of ages do you treat in your practice?
Well, in general, sleep apnea becomes a little bit more common in middle age, and that probably has to do with weight. But I've had people as young as in their 20s with sleep apnea, even if they're thin, and it's usually the genetic facial structure predisposition. But unfortunately, we have a lot of very overweight teenagers now, and I've seen people as young as 18 who had sleep apnea because of excessive weight gain. I do make the point to patients that I treat with sleep apnea that their sleep apnea is very much more dependent on weight than age. So if their weight remains stable, their treatment for sleep apnea may remain stable for many years. So it's a common condition, but something that we can easily treat. And in the last couple of years, we've actually started screening patients here at Southern Maine for sleep apnea, both in the clinics, which is something we do here, but also we have a program where we actually screen the patients in the hospital. And that's because untreated sleep apnea does increase the risk of heart attacks and strokes and irregular heartbeats, many of the common things that cause people to end up in the hospital in the first place.
You mentioned obesity. Are there dietary considerations that you talk to patients about?
Well, what I tell patients is that if they try to diet and exercise and they have sleep apnea that's untreated, research studies show that they're uniformly unsuccessful. You're too tired, your body metabolism is too low from lack of sleep. It's very hard to lose weight in that situation. Whereas if you have sleep apnea and you get it treated, you're much more likely to be able to successfully lose weight. And I have had patients who only have sleep apnea from weight gain, and if they get their sleep apnea treated, they diet and exercise. If they lose enough weight, they can basically cure their sleep apnea.
Now, everybody, of course, has broken sleep from time to time. How would you know if you have sleep apnea? I mean, what are the symptoms?
Well, sleep apnea presents as any source of sleep disruption. Most people understand that if they don't get good sleep, they will be tired during their day. They'll have trouble keeping their eyes open, particularly if they're at a desk or in a chair. And so often I'll get a story that from a spouse or a family member that the patient is always falling asleep in the middle of the movie. They can't get to the end of the movie without ending up asleep. So that's a very common symptom. Interestingly, as people get older, past middle age, their feeling of tiredness and sleepiness actually gets diminished. But more commonly, the lack of sleep from sleep apnea or anything else presents with memory problems, short attention span, being short-tempered, things like that. And I've had patients sent to me because there was concerns about dementia, that maybe the patient had Alzheimer's disease because he couldn't remember anything. He was barking at his wife and being disagreeable. When we did the screening, when we evaluated the patient, we found that they had sleep apnea, and with treatment of that, all of a sudden they got much better. Their memory got better, and their personality became much more back to normal. So it's now recognized by the field of neurology that screening for things like sleep apnea need to be done in elderly patients being referred for problems with memory and should be in the differential diagnosis of something like Alzheimer's disease.
You're listening to Southern Maine Healthcare's Medically Speaking with Robert Erickson. My guest today is Dr. Christopher Hughes from SMHC Neurology, and we'll be right back after this quick commercial message.
Not every boo-boo is an emergency, but it still feels like one. That's why Southern Maine Healthcare offers walk-in care. You'll find compassionate care at wonderfully convenient locations. Open 7 days a week, no appointment necessary. For those times when the unexpected happens. or you're just not feeling great. Look for the orange ball as your sign of the best walk-in care. In Kennebunk, Saco, Waterboro, and Sanford, Southern Maine Healthcare, a member of Maine Health.
And we're back with Dr. Hughes from SMHC Neurology. You've been doing this a long time, Dr. Hughes. You must have seen a lot of interesting cases. What kinds of things do you see in your practice?
Well, I've had many patients who were sent to me in their 50s with concerns about Alzheimer's. Now, first of all, Alzheimer's would be very uncommon at that age. So what I sense before I even see the patient is that there is a concern about memory. And I have had patients whose primary concerns about memory really were related to lack of sleep and sleep apnea. And by correcting their sleep apnea, they were able to function much better. I think that that's something we realize. And often in those situations, the formal memory testing is normal despite the patient's symptoms of not feeling like their memory is working. And what that tells me is that the real issue is concentration, that when they focus on things, they can get things done and they can remember. But if they are sleep deprived, their concentration is poor, and day to day they're having problems. So I've had cases like that. As far as older patients, we do find that sleep apnea, for example, is a very significant risk for heart attack and stroke. And we've had patients who had strokes for no clear reason, and when doing the standard workup, found that they really didn't have very many standard risk factors until we screened them for their sleep apnea and found that that was a significant risk factor and may have been causative in their stroke.
Now, when a patient comes to you and they think they might have sleep apnea, what's the first thing that you do? How do you treat them?
Well, fortunately, we have some good screening tools, and we use these in my clinic all the time. Even when patients are not sent in for concerns about memory or tiredness, my assistant will do the standard screenings. We have something known as the Epworth Sleepiness Scale, which has been around for over 40 years, and it's a series of questions that just assess the degree of sleepiness, and there are normal and abnormal levels. So if a patient screens high on that, then we know they probably have a sleep problem, and statistically sleep apnea would be the most common. Then we have a second screening questionnaire, which is only 5 questions, that has been validated through research. And we use that to try to screen the likelihood of sleep apnea. And as I said, we've been using this in the hospital as well, and find that our results here at Southern Maine are very consistent with what's been published in the literature. In fact, over the last year and a half, we've identified that about a third of patients in the hospital, for whatever reason, do screen positive for high likelihood of sleep apnea. And since it is such an easily treated condition, and we now have more and more research on the medical consequences of untreated sleep apnea, it is very reassuring that we've been able to obtain that consistent result.
Now, we've been talking about sleep apnea. What are the risks? What are the things that can happen for someone who has sleep apnea?
Well, because it does put a strain on the body to have episodes where you stop breathing at night, there's been a lot of research on what kinds of consequences there are to untreated sleep apnea. We know that about 40% of people with atrial fibrillation have sleep apnea, and going the other direction, you're 4 times more likely to develop atrial fibrillation or an irregular heartbeat as a result of those apneic episodes in the middle of the night. And atrial fibrillation does lead to blood clots formation that can lead to stroke. So as a neurologist, I see this connection very clearly. There are also studies that support the idea that untreated sleep apnea does put a higher risk of stroke and heart attack in general. So it's one of the reasons that we are screening the patients in the hospital in order to try to identify people with sleep apnea, because it's likely a factor in why they ended up in the hospital in the first place.
Now, if someone in our listening audience is listening to this and they think, geez, it sounds like maybe I might have some of these symptoms, what are the steps that they should take?
Well, they should talk to their primary doctor about it. The screening questionnaire that we use does ask patients about snoring. Snoring is by far the most common finding in people with sleep apnea. And I would say that in the many years that I've been doing this, if I have a spouse that says, the patient's snoring is so bad I have to sleep in a different room, 100% of the time the patient has sleep apnea. We all snore a little bit, But when people are described as rattling the windows or keeping everybody up, or we can hear them from across the house, 9 times out of 10, that's sleep apnea. Interestingly, there's also a connection with heartburn at night. If you're waking up with heartburn at night, there are 2 common reasons why that occurs. Either you ate too soon just before going to sleep, and really people should not eat anything within 2 hours of going to bed. But when you have episodes where you stop breathing at night, your chest is going up and down, but no air is moving, and that can pull things out of your stomach into your esophagus, and that leads to heartburn. So that's one of the parts of our assessment for people if they have that. The other interesting thing is that sleep apnea can actually cause high blood pressure, and the Academy of Internal Medicine has recognized that sleep apnea is the #1 correctable cause of high blood pressure. I've had many patients who come to me, they're already on blood pressure pills, maybe they're in their 30s, which would be uncommon to have a high blood pressure, but they're overweight and they're tired and sleepy, and I find they have sleep apnea. If I correct their sleep apnea, a lot of times the internist finds that their blood pressure normalizes and they no longer need their blood pressure pills. So because we live in one body and the body is connected to everything else in the body, there are connections between a lot of these types of problems. And when you have sleep apnea, it can raise your blood pressure, it can cause irregular heartbeats, it can put a strain on the heart and lungs, and all of that leads to other different types of health problems.
Now, there's another sleep disorder called insomnia that we often hear a lot about. We see ads on TV about it. Maybe you could tell our audience a little something about insomnia.
Well, insomnia is a big problem, particularly as people get older. Most commonly when younger people or middle-aged people have trouble sleeping at night, it has to do with the psychological stressors of their lives. Worries about money or family members or jobs will cause people to have disrupted sleep. And we now understand that part of that is that the brain organizes thoughts and feelings during sleep. And if those thoughts and feelings are too emotionally laden, it does disrupt the sleep process. So when a younger person comes to see me and they do have a lot of problems with waking up in the middle of the night and having difficulty falling back asleep, then often I will question them about the kinds of psychological stressors that we all experience, because often those are the causes. However, in older patients, insomnia can be a big problem. We're very effective in our ability to sleep when we're younger, as teenagers in our 20s, often into our 30s. But as we get beyond 50, the actual process of sleep becomes less effective. For those who are over 50, you know that you don't run as fast as you used to. Maybe you need glasses because your vision isn't as good. And the process of sleep, again, is not the absence of consciousness. It's an active process. Whereas in the past, you may not have had any trouble sleeping after consuming a cup of coffee in the afternoon, or because you have a little pain in your knee. When you get over 50, those kinds of things can impact sleep. As you get into your 70s and 80s, though, the actual process of sleep declines enough that it's very common and almost normal statistically for people at that age to have disrupted sleep and not be able to sleep a normal 7 or 8 hours. And this is a great concern to people at that age. They get very frustrated being awake in the middle of the night and maybe taking a nap during the day. So very commonly they will complain to their primary doctors, and often sleep medications are given. Now, sleep medicines, sleeping pills can be very helpful for a short period of time. If you're recovering from surgery, you've had a bad injury, loss of a loved one, they can be helpful to help you get to sleep. But chronically, use of sleeping pills in elderly people is a big problem because it does put a big risk on those people. In my old practice, I was in a group with orthopedic surgeons, and my orthopedic surgeons would tell me one of the most common causes of a hip fracture in an elderly person was that they were taking sleeping pills chronically. They would get up in the middle of the night after taking their sleeping pill to use the bathroom, and they may wobble or trip over their slippers and fall and break a hip. So it's something that is very difficult for us to deal with, because we understand the frustration that elderly people have, that they can't sleep through the night, and yet we know the consequences of making people drowsy. So I think that it reinforced for us that when people have sleep problems, they need to be evaluated to see if there's a correctable problem. And sleeping pills, again, can be helpful for a short term, but long term do have consequences that often are something that is rather devastating.
Now, you've mentioned chronic use of sleeping pills. When does the use of sleeping pills become chronic?
Well, if it's being used for to compensate for an episode, like you just got out of the hospital from a surgery, or you've just lost a spouse or a loved one, and you're going through bereavement, a few weeks of sleep aid can be quite helpful. But beyond that, often the sleep medications can lose their effectiveness, or people become dependent on them. And because of the increased risk of drowsiness while if they have to get up in the middle of the night to use the bathroom, it is a concern that I have as a neurologist.
Now, what kind of lifestyle changes do you recommend if someone wants to improve their sleep health?
Well, that's a good question. One thing that a lot of people don't understand is that as an adult, you typically need about 7.5 hours of sleep per night. Now, on the weekend, if you're so inclined, taking a nap in the afternoon can be enjoyable. But a lot of people don't understand that by taking a nap in the afternoon, it will make it harder for you to fall asleep that evening. And I see a number of patients who get into an unfortunate cycle where they don't sleep well at night, they get frustrated, then they're tired during the day, and they end up taking a nap to try to compensate, and that just makes things worse. So in the absence of a primary sleep problem like sleep apnea or restless legs, I try to discourage people from taking naps during the day. The other problem is that people can watch TV, exciting movies, very concerning news reports just before going to bed, and then they have trouble falling asleep. And I make the point that standard sleep research has shown that kind of thing can be disruptive. And if you are having trouble falling asleep for whatever reason, trying to avoid stimulating movies or video games is very important just before going to bed. And again, that's the kind of problem that we see a lot in the teenagers who now love to sit in bed with their cell phones or their iPads, surfing the web, talking to their friends, and then doing this until midnight or 1 a.m., and then ending up being forced to get up in the morning to go to school, and then being tired because of sleep deprivation.
I believe there's some legislation that is going around concerning drowsy drivers. Maybe you could talk a little bit about that.
Well, that's an important issue because so many of us don't get the amount of sleep we need, and because work schedules are now becoming much more flexible. Many people do shift work. We're not getting the quality sleep that we need, and that puts us at risk when we get behind the wheel. There was a very interesting study done in Australia a number of years ago where they took normal people and they took half the group and they purposely made them intoxicated with alcohol. And then they put them on a closed driving course and documented how bad their driving was when they were legally intoxicated. The other group, they didn't give them any alcohol, but they kept them up for 24 hours. They didn't let them sleep at all, and they put them on the driving course in that sleep-deprived state. And the interesting finding was that the sleep-deprived people did just as bad as the people who were intoxicated. Now, there have been a number of states that have recognized that drowsiness in drivers has had a big impact on the number of car accidents that occur. And in fact, just this year, the state of Maine is addressing this in drowsy driving legislation. So the American Academy of Sleep Medicine is working with many states trying to raise awareness of this issue. It is something that hopefully more education can be very helpful to overcome.
Well, this is a fascinating topic, and how can people find out more information? What kind of resources do you recommend if they want to find out more, and if they want to access the resources here at Southern Maine Healthcare?
Well, the first step would be to talk to their primary doctors. If they feel that they are tired, if they think that they're having trouble with their sleeping, they should raise that issue to their primary doctor, and I and others here at Southern Maine can see them if there are concerns about a primary sleep disorder.
Well, we've run out of time for this week. My guest today has been Dr. Christopher Hughes from SMHC Neurology. Dr. Hughes, thank you for sharing some information about a fascinating topic.
Well, it was a pleasure, and hopefully this was helpful information for your listeners.
Join me next week at this time for a new guest and an enlightening discussion about healthcare in our communities. Brought to you exclusively by Southern Maine Healthcare, your trusted resource for healthcare in Southern Maine.